guys, welcome back to Medical Coding with Blue. Today's episode is all about, do medical coders pick their own specialty? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I've noticed a little bit of confusion going on in the comments. So I want to go ahead and clear this up. We have to know what doctors know while never having gone to medical school. However, this does not translate into, oh, I want to be a specialty coder. There's a lot of people that are saying that they don't have experience in medical coding, have never been a medical coder before, but they have their eye on a particular specialty and that's what they want to get certified in. Guys, that's a waste of time, okay? It's a waste of time because when you are coding for a particular specialty, say for example, orthopedics, right? If you're coding for orthopedics, it's not just the bones that you're having to deal with when it comes to diagnoses. You also have to consider everything that's going on with this patient that the doctor is addressing in this note, right? So it's going to require you to know not just about bones and the musculoskeletal system, it's going to require you to understand things like peripheral vascular disease or the effects of tobacco use on the body. And, you know, if the patient has diabetes and that kind of thing. So there's a lot of things that go on with a particular specialty, not just, oh, it's only bones. So when you sort of like, okay, you narrow your focus only on one thing, you are going to miss out on a lot of other things that you need to know. And just because you don't code for that particular specialty doesn't mean that you shouldn't attempt to understand everything. Okay, because it's about being well-rounded. It's not about focusing in on one particular specialty. It is about knowing everything so that you can give yourself the most opportunity. It's the coders that are well-rounded and that can code anywhere and be dropped anywhere and do anything that are the coders that get the most out of their career. You know, this is a long-haul career. This is not something where you get into it and then, oh, I'm really bored with it. The great thing about medical coding is that you can actually go into other specialties as far as like, you know, trying a different clinic. And if you feel bored, obviously you should do that. There's people that have been commenting that, you know, they got out of a particular specialty because they were bored and then they thrived in another specialty. So it really all depends on where you are, but you should never try to just pigeonhole yourself, especially when you don't really kind of know what you're talking about yet. And while you may be fascinated with a particular specialty like psych, it's going to require you to understand not just psychology diagnoses. It's going to require you to understand everything else that goes into it, right? So there's a lot of things that go with a lot of different specialties. And my recommendation for brand new medical coders is that you spend your first 2 years with one certification, the CCS, the gold standard of medical coding credentials, the CCA or the CCSP or the CPC. Any one of these, the CCA and the CCS, both cover inpatient coding and outpatient coding. Inpatient coding, meaning the ICD-10 PCS manual, knowing your DRGs and you're present on admission and that kind of thing because the patient is staying in-house. Or it also requires you to know outpatient coding, working with evaluation and management and the CPT manual and knowing the rules about that we have to code for definitive diagnosis or what do we absolutely know is true about this patient. We can't code for things that are likely, suspected, probable, maybe, and that kind of thing in the outpatient setting. So there's a lot of things to both of these types of settings, and then of course the specialties that are in them, right? But people who have the CCA or the CCS are going to be able to code either or. And then if you have the CCSP or the CPC, again, it's going to test you only on the outpatient side, but you're still going to be asked questions about every single specialty. And again, it's not just about, you know, just trying to pick only one to get really good at. You know, it's about, okay, I know a little bit about everything. So I am going to just give it my best shot, and whatever I get a job in, whatever comes my way is what I'm going to start in. And when you start in a particular specialty, let's just say, for instance, you get hired on at a cardio clinic. And the great thing about cardio is that there's many organizations that are for the heart and helping you to understand. There's a ton of channels on YouTube. Don't ask me specific channels, but they're out there. Just let your fingers do the walking. You can look at cardio procedures online, on YouTube, and you can see how they go. You can go to the American Heart Association. You can learn more about the diagnoses that are seen in particular settings like for cardio. And you can learn all of those things. And you can learn how the body is connected, because of course, the heart is connected to the lungs, which is connected to the rest of the body and everything else. So if the heart doesn't run, it's kind of hard for the rest of the body. It's the same thing like with the brain. If the brain's not running, it's very difficult to get the rest of the body to go. So that's the thing, guys. You have to understand something about everything. And don't just get into that fixated mindset of, oh, I only want to get good at this, okay? So again, the more you spend time with a particular specialty, the better you're going to develop, as long as you are studying. Because there are some people that will get into a specialty and maybe it's an easier specialty and they're like, oh, okay, well, I'm just going to get really good at this. I'm good at this. I don't want to do anything else. And then they spend years there, and they spend years in that particular specialty. I've seen on some job listings that the employer literally said that if your only experience had been with HCC or your only experience had been with physical therapy, that did not count to them as experience, because it's very limited. HCC is just diagnosis coding, and it doesn't matter if you're a senior HCC coder. Somebody was upset with me and was saying that I didn't know what I was talking about. Guys, when it comes to HCC, it's very important. Please hear me when I say that. It's a very important task to do. However, because it's for statistical purposes, really. But it's just diagnosis coding, so it can stunt your growth as a medical coder, okay? That's what I'm saying. It can stunt your growth because you're only coding for diagnoses, and you got to be really good at pathophysiology, which a lot of people are not. And so that's the thing that I will say about that. And as far as physical therapy goes, it's very limited on the procedures that they do, okay? So while it is very important, it is sort of limited. So that's the thing that you have to know. And again, if you spend years and years and years doing only certain things like those things, then it's going to take you out of the running for other opportunities, unless you are still continuing to study, which a lot of people don't. They get really comfortable with where they are, they're happy with it, and they want to stay with it. And then sometimes the rug gets pulled out from under them, like their company goes under, or maybe, they sell the company to another company and they're going to restructure the whole thing, and then that person's out of a job. And then all you've been doing all these years is only staying in one particular clinic, never really trying to reach out and try to say to your employer, hey, I would like to try different things. So it's really important. When I got here to my forever home, and I was sitting in on a meeting when I first got here, and my boss at the time, she said, if you get tired of being in your clinic, if you want to start cross-training with another clinic, you need to let me know, because number one, it's going to help you. Number two, it's going to help us as an organization, because then we're going to have coders that are going to be good everywhere. And in case somebody is out and we need to pick up the slack, it's not going to be this downtime of needing to train folks. So that's the thing that made it so much better. And it was good because, again, you're not just stuck in one specialty. And for some people, they say, well, my boss doesn't want me to move a specialty because they really need me in that specialty. That's not good either, because then that person's keeping you from growing. But it's all on you too, allowing that person to keep you from growing. Guys, there's a ton of jobs out there for medical coders. There is. And once you get your first job, it's going to get easier to find other jobs. You just have to get the first one. And I will say this also, for those of you who will immediately get discouraged when you see that these employers want 3 to 5 years of experience, and how are you supposed to get experience if no one will hire you? Guys, this is where you have to please listen to me when I say this. You still apply anyway. You still apply anyway, and you have a really good resume and a really good cover letter, not just a copy of that darn resume that's out there floating around. It looks so ridiculous, but there's a copy out there that's just floating around. I'm like, really? If I see that, I'm immediately rejecting that resume if I'm a hiring manager. Okay, guys, I have a ton of videos on my channel about resume tips for brand new medical coders. I do resume rewrites. My rate is in the description box below. But you guys have to understand this. No one is going to just roll out the red carpet for brand new medical coders. You have to be proactive, and you have to be actively getting out there and still applying anyway, because to apply for a job is free, guys. It is free. There is no charge to apply for jobs, okay? I'm just saying. And I've always recommended to get yourself registered with a temporary agency. People ask me, which temporary agency do I go to? Guys, you have to Google in your area to see what agencies are out there. There's a lot of big agencies in the major cities, and you can put in there temporary agencies for medical professionals, and you'll see that they all pop up with, okay, we need a person for the front desk, we need a person for medical billing, we need a person for medical coding. And sometimes with these ones for medical coding, it's not just going to be a day job, guys. That's the thing also too, you have to know. It's not just a day job. It is usually like maybe a month, sometimes 2 months, sometimes 3 months. My first job in medical coding was for a temp agency, and it was a 3-month assignment. So that's something that you have to know. It's not just like day labor where you're only working for a day, okay? So that's an option out there for you. And the best thing about temp agencies is that they are looking for a job for you as well, because if you're working, they're making money. And if you're making money, they're making money, everybody's happy. So that's the thing that you should be aware of, okay? But yes, don't just pick one specialty and just stay with it. Now, if you enjoy your specialty and perhaps you have had experience coding in, just different settings like professional fee and just coding for the ER and things like that, and you see a lot of different things, and you want to, you really like orthopedics, and you're like, okay, I'm going to code for orthopedics, and I want to look for a job specifically for orthopedics. So then you take your experience that you had from profi or emergency room, and then you put that in your resume, and you say that you coded also for orthopedics, and you would like to get this job, whatever. And so that's the thing that you can do with time. Do I like orthopedics? I love orthopedics. I love podiatry. I've gotten very good at it too. But I'm also open as a medical coder to always look at other specialties. Sometimes I do have to help out with other specialties, and I'm okay with that, because it doesn't take much. Once you start learning how to do your research, it really doesn't take much to learn different clinics. My boss, when I got here, she said something very memorable that I will never forget even to this day. She said that you are a certified medical coder, right? So this means that you have passed a certification exam. You have been tested on every single specialty in that exam. This means that you should be able to be dropped in anywhere, and you should be able to code. And there's people that panic because they're like, oh no, I'm not used to this and I don't know this. And just take your time and learn it, and it'll be just like when you learned the specialty that you first got into the very first time. And after a while, it gets easier. Okay, so that's what happens when you don't just pigeonhole yourself into just one specialty, guys. It's not like that. You need to know something about everything and be as well-rounded as possible, right? So that being said, it's an exciting world, especially when you are willing to have that time where you're not going to know. And I think that's what stops a lot of people, is that they don't want to be in a position where they don't know. They get comfortable with what they know for this particular specialty, and they're confident, and they don't want to move. And so they're like, I don't want to move, Blue. But you never know. Like I said, there may be times when I want to sneeze. There may be times when you are not going to be given a choice, that your company either goes under or your company gets sold, and then they're going to restructure, and then all of a sudden you find yourself, you're going to be out of a job, right? So that's something that you need to be ready for at all times. We have a very needed skill. Medical coders are needed, okay? And so the one that is well-trained and well-rounded is never going to have to worry. I don't have to worry, guys. Me personally, I never have to worry because of the skill set that I have. I know that if anything happens, I can go anywhere and get a job just with the experience that I have alone. And so that's something that you always should be able to back yourself up with. You know, it's not like before where like how people would like, oh, well, I only did this job and I can't do anything else. You can do anything it is that you want to do. It's just a matter of like making that choice and saying to yourself, hey, no matter what happens, I'm going to try this, and we are going to keep going until I get my goal and get whatever I want, you know, whatever it is that I'm after, you know. And so that's where you'll always feel secure after that. And once you have that mindset that you're always secure, everything else is just, okay, this is gravy now. And now, you know, for me, I've talked about this before, I don't feel like I'm working anymore because this is such a joy for me. I come on here and I share my joy, of course, with all of you. But, you know, I like it. I love medical coding. I like the challenge. I like the puzzle. I like looking at the documentation. I love education. I love training. I love training adults, not just the doctors. I like training adults. I like training other medical coders. I like seeing that, oh, now I get it. I like seeing that look because that just does something for me in my heart. Because when you do that for somebody and you're essentially teaching them to fish, right? Because if you give a man a fish, you feed him for a day. But if you teach a man to fish, you feed him for a lifetime, right? And so that's the thing. That's what I'm doing here. I'm teaching people to fish. When I tell you guys to do your research, here's where you can find this, here's where you can find that. That's why I want y'all to do that. Sometimes I don't answer some of the questions that are really basic anymore because I want those people to learn to do their research. And there will be people that will ask me on more than one platform questions, and I won't answer anymore because these are simple, basic questions that can be answered just even by watching my videos. And I even leave the whole description box right there where it is, and I still will get the question, where can I find the coding guidelines? Did you know that the link actually for 2023 is in the description box? So, you know, that's the thing, guys. I just want y'all to be strong medical coders. That's all I want. And I want y'all to be willing to not just go only with one specialty. And, oh, I want to get all these different credentials. Why, guys? Why? You know, especially when that test has already tested you on all the specialties. Because you want to keep up with somebody else. You know, that's what somebody said to me. Well, so-and-so got this, so I want to get more than them. Why? Are they paying your CEUs? You know, are they? Because if they are, well, then that's different. But more than likely, they're not. And in just having a lot of credentials does not mean that you are proficient. I've seen people with a string of credentials who can't code basic things, guys. I've seen it. And it's sad to me because then you're just paying for a title. You're paying for a title and it's not really genuine. And then when I see people who have less than 2 years of experience, and I'll know because like sometimes they'll be CPCA and they'll have a string of credentials. Do you have experience yet? I had the one who has 4 credentials, wrote me and told me, Blue, I don't know how I'm going to be able to pay for all of these as far like CEUs because I don't even have a job yet. Well, why did you get all of those credentials? Well, my instructor told me to. And they said that it would be beneficial for me. No, friends, no. You learn what you learn getting the one credential. Spend the time. And then if you want to get the specialty credentials, like the other ones that are just different from medical coding, like the CDI or the clinical health data analyst one, that's something that's different. That's good. That you can do, because that's something completely separate from what medical coders do. All right. The degree designations, those are completely different from what medical coders do. So again, it's about that willingness to be well-rounded, that willingness to have that moment of, I don't know stuff. I'm going to feel like I don't know for a while until I keep practicing and I get better. There's no other way to do it other than to practice. No amount of money that you spend can make you a proficient coder. That's literally on you. Spending the time to do the exercises, work through the workbooks. The workbooks that I recommend are in the description box below, and it will get you ready for anything and everything. Okay, because those books cover everything. You know, so that's what I'm saying. The one from the American Hospital Association, that ICD-10-CM and ICD-10-PCS coding handbook with the answers, the CPC study guide, and even if you're taking an AHIIM exam, it's still good because it covers the CPT side, okay, of coding. And AAPC did a good job with that book. I will say that. I will always say that. Because I'm equal opportunity, guys. I don't discriminate when it comes to good study materials, because again, I want y'all to be strong. Y'all are the next generation of medical coders out there watching these videos. And for what I expect for the next generation coming in is hard-working students, hard-working people who are going to learn these things. And yes, with all this artificial intelligence and everything, it's never going to beat the human mind. Never going to beat the human mind. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.